Hey, good morning, everyone. Thanks for being here with us on this Wednesday. My name's Katie Earle, and I'm the coordinator of our University Express program, and I work for the Erie County Department of Senior Services. And we're here again with Darcie Hanson from BlueCross BlueShield. Welcome, Darcie.
Hello, thanks for having me.
Of course, it's always a party when we're together. And we have a bunch of regulars on here today, so I won't bore you with my normal introduction, but feel free to put your questions into the Q&A panel. We will try to get to as many as we can at the end of the presentation, and Darcie's also going to talk about some handouts. So lots of information for you here today. So we'd like to thank the sponsors, which is BlueCross BlueShield of Western New York, Excelsior Orthopedics, Wegmans, and my department at Senior Services for all of the support that they give us. And we're at 858-8526 here at Senior Services if you or a loved one need anything at all. So Darcie, let's see. Darcie has been at BlueCross BlueShield of Western New York for almost 5 years as a registered nurse. In addition to this, she's a per diem nurse on a medical surgical floor at Bertrand Chaffee Hospital. Darcie also has a background in social work and education. She's been teaching classes for University Express for a couple years now and enjoys being able to present on different health topics that affect people in our community. Darcie, thank you. The floor is yours.
All right, thank you, Katie. Hi, everyone. Good morning. So today we're going to talk a little bit about prediabetes. And like Katie mentioned, I do have some handouts that I want to try to pull up at the end if we do have time. And like she had mentioned, like feel free to write your questions in the Q&A and then she'll monitor and I will and myself as we go along. Okay, so let's get started. If I can just figure out how to, here we go. Okay. I always have trouble every time. So let me just hold on one second, everyone. Sorry about that. I just want to move some of these boxes out of my way. Okay, so first slide is just a general description of what prediabetes is. So it's when your blood sugar levels are higher than normal, but not high enough to be considered diabetes. So as we go along, we're going to look at some of those numbers so you kind of have a better idea of what I mean by higher than normal numbers. This slide talks a little bit about what kind of testing can be done to determine how your sugars are. The first test is our A1C. Now, a lot of times when you go to your yearly physicals, your doctors will do a fasting blood test. So I'm sure you probably all are most of you are aware of what that is. The A1C is a test that measures your sugar for the past 2 to 3 months. So this isn't a test that's normally done during your yearly physicals, but if your doctor starts to see that your sugars are a little bit elevated, they may call for the A1C to see how you've been doing over the past few months. This test, you really can't, I guess, I'm not sure if I'm saying this right, hide from. What I mean by that is a lot of times when people know they have to go for a fasting blood sugar test, they may not eat any sugar or carbs for the days prior or kind of watch what they're doing a couple days before so that the numbers really is not going to be as bad. With this test, there's no way to do that. It's going to show how you've been for the past 2 to 3 months, no matter what. The numbers I have here for a normal level, so someone that doesn't have any issues with their sugar, no prediabetes, will be 5.7 or below. Someone who's pre-diabetic, they may go in the range of 5.7 to 6.4. And if you're a diabetic, you usually you may have one that's 6.5 or higher. Your doctor will kind of talk to you about where they want your number to fall, but these are just some general guidelines to see where, if you maybe you've had a recent A1C, you know your number, this is kind of a way to determine where you're at. I was mentioning the fasting glucose test. This is the one that's typically done during your yearly physicals. Usually you don't eat for 8 to 10 hours, and these are the numbers these are the guidelines that we like to kind of to keep you at. Normal would be anything 99 below, pre-diabetic 100 to 125, and diabetics will typically be 126 or higher. If you have let's say you go to your physical and your sugars are a little high that one time, your doctor may not automatically be like, oh, he or she's diabetic. No, they may watch it they may make you retest, keep an eye on it, watch it the next time before they even kind of go over the diabetic part. So don't panic if you've had one elevated sugar. Sometimes people forget to fast or It's just an off reading. So one test is not the deal breaker. They may do additional ones too as well. But this is the most common type of test that the doctors typically use. The last one I mentioned is the oral glucose tolerance test. This test is done before you get your sugars tested. You drink 2 hours, you get it done before, then you drink a sugary drink and you get it 2 hours after. And I also put the numbers that we would like to see, normal less than 140, pre-diabetic 140 to 199, and diabetic 200 or higher. A lot of times when women are pregnant, they'll do a similar test like this, that oral glucose test, where they'll do the exact same thing so they can kind of see if they have any issues with gestational diabetes. You may not see this oral glucose test as much. Again, the most common one is the fasting. So this is just a little list of what can cause sugars to rise. Eating more carbs or sweets. This is the most common one. Sweets, the sugars, the baked goods. Carbs I mentioned too, because some people don't realize that carbs convert into sugar after it's broken down. So I do talk to a lot of people that are like, well, I don't eat sweets. I don't eat cookies. I don't eat, I can't even think of sweets right now. I mean, there's so many cookies, cakes. So I'll ask them, well, do you eat a lot of bread or do you eat a lot of potatoes? And that's kind of where their carbs, that's kind of where their sugars are coming from. So just, you have to be aware of your carbs as well. Side effects of medications. Steroids tend to elevate people's sugar. So even when I'm at the hospital, people may not have any issues with their sugars, but they may be on a steroid and it's causing them to elevate. So there's other medications as well, but that's a very common one. Infection or illness, that's huge too. A lot of times people aren't diabetic at all. They have some kind of trauma to their body's fighting infection, their sugars tend to rise. And usually once they're home, they stable out again and things are fine, but keep in mind that can also cause them to rise. As we get older, 45 years or older, that causes sugars to rise. Some races are more prone to higher sugars. So I listed a few here: African Americans, American Indians, Asian Americans, Pacific Islander, Latino American descent as well. High cholesterol, high blood pressure, they all correlate with high sugars, inactivity, and sometimes if you have a history of gestational diabetes. Now, this is more geared towards a type 2 diabetic, I should say. I think I have a slide coming over. Type 1 diabetics are born with the inability to produce insulin. There's other things that are going on. This is more related to a type 2 diabetic. I just wanted to make sure I clarified that. So these are, again, another list I put together for risks of high blood sugar. These things will cause, if your sugars are high, out of control, not being controlled, these things can happen. Amputations, heart attack or stroke, kidney issues, increased healing time, blindness, there's an increased chance for Alzheimer's, nerve damage, and neuropathy. So some of these correlate with each other. So the nerve damage and the neuropathy, that's like that numbness and tingling that people may get in their hands and feet related to uncontrolled sugars can be one of the issues. I say amputations because a lot of times they lose their feelings and sensations in these parts of their body, causing them to, let's say, you get a cut, causing them not to heal as well, and that may lead to maybe have an amputation of a toe or things like that. The increased healing time when you're a diabetic or when your sugars are uncontrolled, you have an increased healing time. Your body doesn't heal as well as someone who may not. Again, that could also cause issues with the amputations. So they're all kind of intertwined, I would say. Heart attack or stroke, that's a lot of times with the sugar, that's going to cause some buildup and plaque in your arteries to harden things, and that's where that heart attack or stroke comes from. Same thing with the kidney issues. Blindness, again, sugars, it's interesting because having high sugars and uncontrolled sugars, it causes so many issues within your body. So again, eyes is another thing that they can having uncontrolled sugar can cause issues with your eyes. So it's really important if you're starting to get up there with those high sugars to get those under control before you go over into that diabetic range. And even if you do go into the diabetic area, you can still manage and control it. It's all about keeping those numbers down and getting the diabetes under control. Excuse me. So there's ways to help decrease your blood sugar. Nutritional changes are huge. So if you go for your checkups and your doctor's noticing that your sugars are high, they may have a conversation with you about lifestyle changes. So they may talk to you about your diet, your physical activity. Those things will change. They want you to change those things first before they necessarily just put you on a medication. So one of the good ways with nutritional changes is to increase non-starchy vegetables, which I do have a list in this PowerPoint, so we can go over that. Cut back on sweets and foods high in carbohydrates, increase your whole grains, and eat lean proteins. So I have some slides coming up with some good examples, because sometimes if someone just tells you this, it's hard just to understand what this even means. And I know even for myself, I wouldn't even know what to do with some of this stuff. So we'll go through that as we go along. So this is an excellent list of healthy food choices, the non-starchy vegetables. So the non-starchy vegetables have less carbs in it. So these are, if you're trying to watch your carb intake, these are some good examples of vegetables to look for when you're at the grocery store. Spinach, carrots, lettuce, green beans, broccoli, cauliflower, tomatoes, mushrooms, peppers, asparagus, and celery. Always try, fresh vegetables are wonderful. You could even do the steamed ones like the broccoli and cauliflower. I tend not to do anything with like canned vegetables just because the sodium content, like no, if you can avoid that. But if you do have to, if you let's say that's something you enjoy, make sure you rinse them off first if you're going for like a canned green bean or something like that. But this is a good list to have. So if you're looking to get those non-starchy veggies with a lot less carbs, this is a good list to start with. And I can put this back on here if you need me after we're done, if people are writing down or taking down examples. Just let me know in the questions. Again, protein is another good healthy food choices. We want you to have some lean protein. So chicken, pork, lean meats, fish, eggs. A pork loin would be a good example of like a lean pork. Starches and grains, if you are looking to switch over from those white ones, brown rice, sweet potatoes, whole wheat bread, whole wheat pasta, black beans, lima beans, pinto beans, quinoa are all good choices. The beans have protein in them as well, so that's a good option too. But these are kind of the healthier choices if you want to eat some kind of starch and grain. Exercise is a great way to help maintain a healthy body weight and also keep your sugars under control. So your doctor may also talk to you about increasing your exercise to, I think I have on here, moderate activity, maybe a brisk walk, 30 minutes a day, 5 days a week. Now, if you can't do that, because I know sometimes I can't get a walk in every day with my life and things going on, even if you start with a short amount, even if it's only a 10-minute walk a few days a week and work to increase that, it's still better moving than not doing anything at all. So I thought this was interesting, so I put it in here. Losing 5 to 7% of your body weight, so just 10 to 14 pounds for someone who, let's say, weighs 200 pounds, can lower your risk for developing type 2 diabetes. I know it's hard just to lose 10 pounds just like that, but even just losing that small amount could be super beneficial. I put in some tips and tricks to ways to increase exercise, short walks, dancing, balance exercises, stretching, and strength exercises. But again, even if you're just getting up and doing a short walk, it's better than not doing anything at all. It's still going to all come together and help. If you want to do 30 minutes of exercise a day, but you can't do it all at once, do 3 10-minute walks throughout the day. It's still going to help. See, I feel like I had I just want to check something because I feel like, I'm sorry, everyone. I feel like I'm missing a slide somewhere and I don't know. Maybe I'm not. Does anybody have any questions before I pull up the sheets we can kind of talk about?
One of the questions I'm seeing is, can you explain how fasting impacts your levels?
So they want you to fast so you don't have anything in your system to show what your blood level is, an accurate blood level reading. So they want you to not have any kind of sugar, carbs, anything in there so they can see what your blood level is at with nothing in there. So if you have, let's say you eat something, it's going to increase your sugars. So you're not really going to get an accurate reading of what your blood sugar is if you do eat something or drink something before the test. Did I answer that question?
I think so.
And I'm sorry if you hear my house phone ringing, no one ever calls me and suddenly somebody is calling and I'm sure it's a telemarketer. So you have to let that ring out for a little bit.
This next one is, how often would you have your levels checked if your doctor recommended the, I'm assuming, diet changes?
So a lot of people will go for their physical and if their sugar's high, the doctor may want to recheck it, let's say in 6 months. I've heard people do 3 months, I've heard 6 months, or they'll wait till the following year and just have it checked again. So that's kind of based on that conversation with your doctor to see how often they want you to check it. I mean, if it's not really high and it's never really happened before, they may just say, okay, we'll do it again next year. But if they think it's teetering a little bit often, then they may do it every 3 to 6 months just to see.
Okay. Thanks, Darcie. And then the last question I'm seeing for right now is, can you talk a little bit about the meds that are available?
That's where I think I'm missing my slide. I don't know if I redid this, but one of the common meds that your doctor may put you on in the beginning is a medication called metformin. That's an oral pill. So that I've heard a lot of people prescribe that if their sugars are kind of high a couple of times, they may put you on a dose of metformin. There's a ton of pills, shots, injections, things like that. But with the pre-diabetic, they may start you with like a metformin before you even have to go to that route. I mean, of course, there's insulin, but that's down the road if you're not able to get your sugars under control with your lifestyle changes and maybe like an oral medication like metformin. And before I do this presentation again, I have to see where that slide is. But again, there's a lot of medications that they can start you off just to help before you would even have to do any of those shots, injections, or anything like that. So it's good to get it in gear before you even have to go that route, if that makes sense.
Yeah, thanks, Darcie. This question just came in. It's, how long a period of time is typical to linger in pre-diabetes?
That's a really good question because I don't know if there's a certain I feel like it's more of a doctor-based conversation with your doctor. I don't know if there's like, oh, 1 year high sugars, you're going to be diabetic. I don't know if once those numbers come over too far and they just don't go back down is when you kind of go into the diabetic range. I don't have a great answer to that question. I actually really like that question because I don't know if there is a set amount of time, but I would say if you went today for your physical and got your test and then you went back 6 months and it's not going down and maybe another few months it wasn't going down, they may at that point decide that you're in the diabetic range. But I think like I said, I don't have an actual time frame for that. So I think it's kind of based on your conversations with your doctor and how you're doing throughout that period. So I'm sorry, that's not a great answer. And I've never had anyone ask me that. And I think I'm actually going to try to see if there is like an actual answer to that.
Mm-hmm. That makes sense. And then this next question is, how will I physically know if my sugars are high? Or will I physically know?
Yeah, sometimes you'll start to have different issues when your sugars are high. You'll be like really thirsty a lot. You may have like, you may be going to the bathroom a lot. You may be like frequent urination, but not like a lot of urine. So you'll get that increased thirst, increased hunger. Some people will get like this fruity smell in their breath. So there are ways to kind of see, but excuse me, that's more of like higher sugar amounts, like once you get beyond that pre-diabetic range. So you may not even know, like we're sitting here right now, your sugars may be a little elevated. You haven't gone to your physical in a few months. You may not have any symptoms. Some of those come later on when they're, people, I don't want to make anyone nervous, but like when they're super high, they end up going to the hospital because they're having all these issues. And then they find out their sugars are like 500-600. So you may not have anything right now, but sometimes, yes, your body will do those things.
All right, thank you. Oh, this is, could you explain the physiology of how the pancreas and other organs malfunction with this disease?
That's a really good question that I used to be able to explain exactly what happened with your pancreas. But I know that in a gist of it, and like I had mentioned earlier in this presentation, the type 1 diabetics. So basically they're born and their pancreas is not producing these beta cells that make insulin. So if they're not producing enough insulin, they're not able to control the sugar that they're eating with the insulin. So I think at a certain point of your body with the type 2 diabetics is your body is just not able to produce enough insulin with the pancreas, enough insulin to help to manage the diabetes. So then I want to explain this in a way that doesn't sound, I hope I'm doing it okay. So the insulin will go into the cells to help control the sugars, but then at a certain point, they're not making enough. So then the sugar is in the bloodstream, and that's how you get those fasting blood sugars that are high. I should find a better maybe a better handout or something to explain that, but that's the gist of that. If I did okay with that, if not, I can get a better answer for you. But that's kind of what happens. The body just is not producing enough insulin to keep up with the amount of sugar that you're eating.
Okay, thanks, Darcie. I'm not seeing anything else come through yet, so if you want to go into your handouts, that'd be great.
Okay, let me see how I do this. Where the heck? Oh wait, not stop video, right?
Yep, just stop sharing.
Oh, why can't I remember that ever? Oh, it's the biggest button too. Okay, so what did I say? All right, give me 1 second, you guys.
You're fine.
Okay, so this was, can you see the whole screen?
We see it and you just have to scroll down when you're explaining it, but it looks fine.
So I thought this was just kind of an I mean, you might have seen this before. I'm sure a lot of people have seen the plate that was divided, but I thought this was a good example of how to divide your plate. You draw the line down the middle and then the one to the right that splits the protein and the starch. So half the side should be your veggies, your protein, and then the starch. So just go down. We talked a little bit about the vegetables, and then they have a couple listed here. The protein that you may want to add in, if you're taking any notes, you might want to write some of these options down. Salmon, tuna, I don't think I had on my PowerPoint, turkey. Same thing in the starch section with some grains and starchy foods. We talked a little bit about the beans. If you want like a piece of whole wheat bread, and then so they actually have some starchier veggies in there if you're like those ones better, corn and green peas. And this is where your rice and quinoa and pasta and potatoes would come in. You can fill in with some fruit and dairy and then drink, something unsweetened or water. If you're going to add fats in it, they talk about like the healthy fats like avocados or nuts, but in small amounts. Sometimes people are like, oh, I'm going to eat nuts because there's no carbs in it, but then you're eating an excessive amount of nuts and then you have more fats, then it's just not, you're defeating the point. So if you're going to have some nuts, there's nothing wrong with it. Just maybe have like a small serving size, like according to like whatever the jar is. The olive oils obviously are a healthy fat. So this actually gives you example, if you want to, I don't have a way to send this to you guys, but Let's see. What else is on here? This is just if you had it, you could write it out and stuff like that.
Darcie, if you email it to me after we're done here, I can send it to everybody who's on via email.
Okay, if people feel that would be helpful, I'll definitely do that. This one, can you see this? Okay. Is it small?
It's a little small, so if you zoom in, that'd be great. Even that's better. Perfect.
Okay, so we talked a little bit about the testing. So these are the 3 that we talked about. And again, the same way to lower it would be same idea with the nutrition, exercise. This talks too about losing the 7% of your body weight. We talked about that. Doing moderate or physical activity 5 days a week, the best you can. I don't probably need to send this one. We kind of went over this. Same idea of the risk factors being overweight, 45 or older, family history, gestational diabetes, and then the different ethnic groups. So, here's a little description about insulin. What someone had asked about the pancreas. So insulin's a hormone that's made by the pancreas, a large gland behind your stomach, help insulins move from your body into your blood cells, or excuse me, your blood into your body cells. So our cells need energy, sugar for energy, and carbs for energy as well. When you have insulin resistance, your body produces insulin, but does not use it effectively. So the sugars will build up in your bloodstream. So they actually described this a little bit better than what I did. It was the same idea, but this is actually sounds a little bit better. So that's the gist with the type 2. So again, with your type 1, this PowerPoint doesn't really pertain to you, but again, if you're type 1, your body is born without, your pancreas is not able to make these cells at all. So that's where that type 1 comes in. So, but the good news is that if people find out early they have insulin resistance, they may be able to delay progression to type 2 diabetes. So again, those different things we talked about changing will help. And here's, oh wait. Shoot, I wish I would have pulled this up earlier. Sorry, you guys, why is it messing with me? So this is a little picture they have. So insulin works like a key. It unlocks the doors to your cells. So once the cell door is open, sugar is able to move from the blood into the cells where it belongs. So then once it's inside your cells, that's where it provides the energy. So again, if your cells are resistant to all that insulin, then it's going to leak out into your bloodstream. And that's where we start having those issues of the high sugars. Oh, I hope this makes sense to everybody. I know that part's confusing. Whenever it comes to like what happens inside of us is trickier to explain. Okay. So this last one is kind of cool, where it talks about different foods and how many carbs are in them. So one starch choice on this sheet is 15 grams of carbs, 3 grams of protein, 1 gram of fat, and 80 calories. But what I like about this is it kind of gives you an idea of what exactly is like a serving size. So I forgot to mention this, but a lot of people will say, well, how many carbs should I be eating a meal? And I have done this PowerPoint with our dietitian before, and it always comes back to like, you want to have that conversation with your doctor or dietitian where they can tell you, based on your body height, weight, and activity level, what is a good amount for you to have. So you can kind of know where you should be staying within that range. But what I like about this is it just kind of shows you, like it says a bagel, a quarter of a bagel, that's about 15 grams of carbs. So this sheet is huge. It has starchy vegetables, beans. I thought this might be interesting to kind of give people an idea of the amount of carbs. But again, you want to talk to somebody, whether it's a dietitian or your doctor, to see if they can give you an idea. They may say, oh, you should have 45 grams of carbs a meal, but somebody else may have 60. So you just want to know where you're at before you start cutting back. But I also wanted to know too, fruit, obviously we want people to eat fruit because it's good for you, but you keep in mind there is natural sugars in fruit too that will affect your sugars. Berries have the least amount of sugar. Those are the ones that are like a good go-tos for people that are trying to watch their sugars but love to have some fruit. So blackberries, blueberries, raspberries, those type of berries are really good for you too. So if you're looking to cut back on sugars, try to grab those options as well. So yeah, this is, like I said, this is a good, if people are interested, I can send this over. So you can kind of use it as a guideline. I used to have a different one that I gave out in class, but then this one's a little bit more updated. So I can definitely send that over if you want.
That would be awesome because
Does anybody, what's that? Go ahead.
I was going to say that would be awesome because we have a couple people that asked for the handouts. So we'll definitely get those out to them.
Yeah, like you can use them as a guideline. I may have another one I'm going to try to find with snack ideas. I didn't pull it up because I think that a lot of people struggle with like the snacking part. Well, I know for me, like I could eat healthy all day, wonderfully, whatever. And then as soon as I sit down for a few minutes with my kids at night, we're like, we need a snack. And we don't really need a snack, but I know like it's just like habit. So I think I may have another one that gives you some snack ideas that have less carbs. So if you're looking to spice it up a little bit or switch things around a little bit because you don't want to keep eating pretzels, but you want something, I can see if I can share that with you guys as well.
That would be awesome.
Anybody have any questions, comments? I know that when I do this in person, sometimes people will say, oh, you know, this really worked for me, or I tried this. And so I'm open to that if anybody has anything to share. If not, that's fine too.
Couple things are coming through here. So I've got just checked my glucose level for my latest blood work. It's 83. Is diabetes hereditary?
So 83 is an awesome number, by the way, for a fasting blood sugar. So great job. And type 1 diabetics a lot of it is hereditary, the type 1 diabetes. There's some hereditary factor to type 2, but a lot of it is based on lifestyle. Some people, it is there a little bit, like some people like, oh, my grandma had it or this person had it. So there's a little bit, but that's mostly type 1. Type 2 is a lot of lifestyle, how you're exercising and eating and things like that. So a little bit of hereditary in that type, but mostly that's type 1. But great job on the blood sugar because that's a good number. That's excellent.
Thanks, Darcie. This next one is a clarifying question. So low blood sugar is the lack of enough sugars to fuel the cells or insulin resistance?
So when you're insulin resistant, you're going to have higher blood sugars because the cell's not able to take in all that insulin, or excuse me, all that sugar. So it's going to go into the bloodstream. So when you're insulin resistant, your blood sugar is going to be higher.
Okay.
Was that okay?
I think so. Can you speak at all to like low blood sugar and maybe what to do for that if people are noticing that or feel off?
Yeah, sometimes people have low blood sugar and you may feel like confused, or some people will have like nausea. Usually you don't want your sugars to be, I'm trying to think a good number. I'd say like less than 70 is your sugars are starting to get low. I could have a better number. I don't have the most accurate number, but I'm going with anything less than that. You want to make sure you eat something because it's going to throw your body off as well. I've had people that I've in the hospital where they are completely fine. And then the next minute we go in there and they're confused, they're erratic, and it's their sugars are so low. So they have to eat something. So I guess you have to be careful for that too. So make sure you're eating 3 meals a day. Make sure you're having a snack. You don't want those sugars to drop as well. So that's, it's important on that end too.
Okay, thanks, Darcie. This next thing is if your glucose and A1C continue to hold at the high side of normal for a number of years, not going down, but not going up, is it smart to hold off on going on metformin, or would it be smarter to start on a small dose?
I think you probably at that point would talk to your doctor and they may do that. They may do a small dose to get you a little bit lower on the lower side. So my answer to that would be, it has to be based on what you're comfortable with too. A lot of people are like, I'm not going on medication. I don't want any medication. I want to do it this way. But if if you're at that level and it's not going down, it's not going higher, and your doctor thinks maybe a small dose would be beneficial, then that might be something that would work for you too. Again, that would probably be that conversation you'd have with your doctor and see what they recommend, but it's definitely something that people do at that point.
All right, thank you for that. And the person who asked the question about the low blood sugar and insulin resistance said, okay, thanks, much clearer.
Okay, thank you. And that's actually good to add to this PowerPoint as well. You know, just a little tidbit on that. I know it's not the same topic, but it's good to know too as well that you want those sugars to stay, you want to be eating your meals. You don't want to go all day without eating. It's going to affect your sugars in that way where they're going to be lower, and it's not good for you as well.
Okay, thanks, Darce. Once you write that down, I'll ask you the last question.
I'm just adding some things to my, good, thank you.
All right, so this one is, do I need to be concerned about any meds impacting my sugar levels?
So sometimes, like I had mentioned, the prednisone, that's a type of steroid that could make your sugars go higher. So there's a lot of different side effects and a lot of different medications. I think that the best option, I mean, you can ask your pharmacist, you can go over your meds with your doctor just to double check, but I know that's the most common. I'm sure there's other ones, but definitely be aware of what you're taking, have that conversation with your doctor, make sure if you're a diabetic, I'm assuming your doctor would, or your sugars are a little high, I'm assuming your doctor would know when they put you on something, whether it's going to have an impact on your sugar. So, and you could even ask the pharmacist what you're taking or go through that with your pharmacist and they can tell you the side effects. Because there's so many side effects to everything. It's crazy when you're taking medication, you're like, the side effects are so high. So definitely have that conversation with your pharmacist or your doctor to make sure before you take anything.
All right, thanks, Darcie. We'll just give it a second here to see if any more questions come through. Is there anything else you want to add while we're waiting?
No, I think that's good. I'm happy that people had questions, and thanks for some of the questions that I can add to the next time, because I think those are going to be helpful. I always like to add to things because obviously if someone's thinking it and asking it, there's probably more than that one person. So
Definitely. So now I'm just saying thanks for a great presentation. Thanks, gonna go check my numbers. So
well, thank you. And I don't know what what everybody's health insurance is and what they have, but I know at BlueCross, we have nutritionists available to speak to free through your insurance. So different insurances may have something. So always check with them too. They may have a nutritionist to speak with over the phone. Maybe that would be helpful for you too.
Thanks, Darcie. And I apologize if you're hearing any construction in the back here, folks. But last question that just popped in is, how does coffee on an empty stomach in the AM affect you?
Coffee on an empty stomach? I guess I don't know how much coffee has an effect on your sugars. I know people have had black coffee before their fasting blood sugars, and I don't think it makes a huge difference. I think it's more of like what you put in it. If you're putting cream and sugar in it, it's going to obviously increase your sugars. But I think just a cup of black coffee alone, I don't think it makes a huge difference with your numbers. But again, it's more of what you're putting into it. So don't do anything like that before your blood sugar. Don't have what do they call it? Like a double. I don't even know. I never even drink it. Don't do that before your fasting blood sugar. Just either don't have anything or just have a small black coffee.
I'm sure that would definitely throw off the numbers.
Yes, I have people said, oh, I didn't fast, I ate. They told me that they're eating. I'm like, okay, well, that's why your sugars were not good. So keep that in mind.
Okay, well, I'm not seeing anything else come through. So Darcie, thank you for your time.
Okay.
And to everyone,
thanks, everyone.
On. Thank you.
All right, sounds good. And I'll email you that stuff, okay?
Perfect, and I'll get it out. Sounds good.
All right.